I see a few people already. Hi, everybody.
Hi, everybody.
Hi, Sarah.
Hi, Sarah.
Hi.
Hi, Naisha. Hi, Dawn.
Good to have the crew back together again.
I know, right?
The troublemakers.
Hi, Anna.
Did you see my emails, David?
I sure did. Of course, table nine.
Table 9 brought extra credit.
True story.
And may I add, that was my complex case that I got at the end of the day, which I can share at the end
Oh, okay.
if you
Okay.
want.
Yeah, I mean, we're more than happy to talk, the complex cases. So, well, I think Lou, go ahead and start it. I mean, welcome
Okay.
everybody in. It's nice to have everybody in here. We did the cracking complex cases at the conference. We talked over some different things. We didn't talk about one particular case necessarily, but Lou's here to go over a hard case. And then as long as there's some time at the end here, Sarah's got one for us as well.
Absolutely. Here you go. Well, this case is never resolved, unlike David here, that's been resolved. So mine is about a patient that is, what is the next? Can you send next? Here you go. Um, My case is a pediatric off-label for Rinvoq. She's a 9 years old. Diagnosis is atopic dermatitis and vitiligo. And patient have a chronic back pain. Patient's insurance is commercial, Aetna primary, and secondary is Medicaid. Next. Case background. Patients prescribed Rinvoq for AD with concurrent vitiligo. The PA was submitted under the AD. Initial denial, patient age below 12 years old, insufficient safety efficacy data. And then the first level appeal reviewed by dermatologist denied as not medically necessary. And the second level appeal denied again, internal appeal process exhausted. Next. So the current status is patient is on the patient is actually still on samples. The doctor said we're just going to continue since it's the end of the year. We're just going to continue on the samples until next year. We're going to get it reprocessed. Okay, next. So my thing is, does anybody have a discussion point? Um, anybody have a success getting a Rinvoq approved for off-label for AD or vitiligo? With this patient under 12 years old, what documentation, studies, or approaches have strengthened your appeal? Any alternative or bridging therapies recommended until patient meets age criteria, or any insights on upcoming data or label expansion for pediatric AD or vitiligo? Um, can anybody help me with that? This case is still open.
Yeah, and anybody can, feel free, jump off, take your mute off and kind of share some ideas if you've done it or have had something similar. Um, I have to say I'm a little stumped, Lou. You got me. Um, but we have a good team here, and we'll definitely get you some good things here. So yeah, I'm looking forward to hearing thoughts.
I do have a
Yes.
follow-up question for Lou. Since
Yes.
the patient was sampled, have they been seen and had a chart note as to follow up with the sample?
Yes, because every time that they get the sample, they come in.
Okay. And
So,
is he showing improvement or he?
yes,
Okay.
improvement of their AD because they have AD, but it's supposed to be for vitiligo.
Or
Um,
is there any repigmentation that's appearing with the
well,
sample?
for this one, since I just got back from a vacation and a
Right.
conference, the patient won't be here in 2 weeks.
Okay.
So
Okay.
that's the latest that we have. but the denial has already been exhausted. AbbVie already said that they're not because it's the off-label. But I was just told because I went to the PAMS this weekend,
Mm-hmm.
I talked to the AbbVie people and they said like to submit it through Patients Assistance Program. So I said, I got the denial. And then she said that you got the bridge denial because it was off label. You did not get the denial for PAP. And I said, I will check that. But in some reasons, I don't have the paperwork anymore. And I thought that it says it was denied for PAP. But
Okay.
she said that it can get approved for PAP. The bridge will not go through, but PAP might.
Right. Pat May. I actually did a little research via Chat GPT, which I'd be happy to send to you.
Oh,
I have more or less a dissertation, um, but it was to ask for a formulary exception and an external case review combined with medical necessity. And with ChatGPT, I was able to get rationale as to why Rinvoq should be used off-label,
mm-hmm.
medical necessity justification that I sent to David. If you want to send me your email address, I'd be happy to forward it on to you.
Definitely. Oh, definitely, because I needed this because the doctor was just like, okay, we're just gonna breathe right now, but we're just gonna
Mm-hmm.
sample the patient until end of this year, but we're gonna start again next year.
Yeah.
And
But
I
I have my actually when I talked to my rep, I mean my FRM, she said that possible, like off topic, but she said that try to do a liquid that it might go through. And
How
then,
would you dose it?
yeah, for the dosing, but the dosing would be up to max 6 ml for that. And what happens is Catherine Vargas, actually, I don't know if she's here, but she had the same case. Patient is 9 years old too, or 6 years old. She got it approved for the liquid, but the patient have AD. Um, PSA, because the liquid is for PSA 2 years old and up.
Oh, okay.
Yes, but they don't have that for dermatology. It's rheumatology, and so
Has it
that's why.
been
But she got it
biopsy?
approved.
Has it been biopsy, like a punch biopsy?
Because she just told me earlier, like before that,
Mm-hmm.
she's like, "Oh, I got mine approved," but I don't know. I was just like, "Oh, I wish that we knew about it before the meeting," but I
Right.
haven't read how she did it and stuff like that.
Yeah, I'd be curious, like if they did like a punch biopsy,
Mm-hmm.
you could argue that because if it's taken by mouth or it'd be a systemic absorption versus topical because the BSA would be greater than what the atopic indication would allow for
Right.
with, like, say, Opsilura, for instance.
Right.
look at me, I'm learning some stuff here too, because I'm like, I'm gonna have something like this pop up in the next upcoming week, and I'm gonna be like, remember when we talked about this?
That's why I
Right.
created an email because then I have a thread.
Yep.
Yeah. Anybody else have anything that might able to share that you have take it out in your chest and maybe I'll take it, please.
I mean, have you tried like
Listeners.
pictures, letters from like
I did
school,
send
family?
pictures.
Did you get like some letters from like family, even other providers? Sometimes maybe like if they have a pediatrician. No.
Okay.
Also,
Could you
too,
try?
oh, sorry, go ahead.
Oh, sorry. I actually feel like I did this in reverse because I saw the chronic back pain and I was thinking, what if she was, um, can she get a rheumatology exam and like rule in or out psoriatic or juvenile psoriatic arthritis that is on label for Rinvoq?
Right? Because of the chronic pain, back pain that she have too.
Yeah, that's where I started. I mean, because the Rinvoq is in phase 3 trials for adolescents, so maybe you could use the phase 2 study data to submit as well.
Ah, Anna, thank you.
And then the other thing that I was thinking is that if you know somebody else who has gotten it approved off label, if maybe that doctor could write a letter that says, like, my patient has been doing well in using off dose or off label Rinvoq, and steroids are not indicated for such long term use.
Right?
And she doesn't really qualify for Adbury, Dupixent, or other traditional biologics because of the other issues that she has.
Oh, okay. I'll put that better. Thank you, Anna. That's good. I like that. Anybody else?
I was just thinking, I would pull back to the growth and development with sleep for atopic patients or autoimmune patients. If they don't get adequate sleep, they're not going to meet their normal growth and development milestones, and it would also impact their education, or their education, I should say, and growth and development, as well as like psychosocial um,
Oh, yeah.
impairments. They're not going to want to do activities. They're not going to want to be at school. They may be more reclusive, and
It's a
also
lifestyle
impacting the
hindrance.
and also
Lifestyle insurance.
lifestyle and impacting the family unit. Because the parents, it's going to put a strain on the marriage. It's going to put a strain on them
Absolutely.
financially, and also having to make all of these appointments, not to mention the stress of their child, going through this and possibly needing therapy, like mental health therapy.
That is awesome. Thank you.
Luke, and maybe I missed it because I'm absorbing exactly what Sarah and what Anna was saying, and even Naisha. So the Rinvoq is for AD and vitiligo, but they've done
Correct.
topicals, right?
They've done topicals. They've done Opsilura. They've
Just
done
Opzelura?
Opsilura. They've done oh my gosh, here. Um, they did steroids, corticosteroids.
Hmm.
They did that, and it is actually mainly for vitiligo.
Okay.
That's what, but then they have underlying, which is the rashes around it and the back pain.
And I'm also thinking, like, because I'm sure, I mean, all of us would think outside of the box. If you did a peer to peer almost, you could
Peer to peer.
fight a little bit more. I have seen success in mentioning everything under the sun that the patient has done and why we're going down this road, even if it's over the counter medications. You start telling them, like, hey, they did um, the CeraVe eczema line, or they did the Eucerin eczema line, and then you start rattling off the OTC stuff, and then you start getting into the prescription stuff. You kind of bombard them with more.
Yeah.
I mean,
Um,
that's more. Yes, it's more work on your end, but at the end of the day, like, you're giving them the whys. They want to know why.
Mhm.
Why not?
So when you're talking about peer to peer, do
Hmm.
you do your own peer to peer? Do you give that to the provider to do it?
So it depends. I do have
It
some
depends. Okay.
providers that would prefer to do their own peer-to-peer. The downside with that is you can never make a provider be on time.
Right, because it's
So,
scheduled now. It's no longer, unlike before, the peer-to-peer, you can schedule it right in there and then they just wait.
right.
But now you have to schedule it like different times and date,
Mhm.
and then they
Yeah.
will call us.
So typically, as long as you like, and then I have my other providers that as long as you coordinate with them and you get their bullet points, then you can, speak on their behalf and just be like, the provider said A, B, C, D. Now there might be some rebuttals that you might not be able to come back with um, because you're speaking to another provider. Um, but what's it going to hurt? You've already been told no. Um, so why not just keep trying for your patient? And at the end of the day, too, you can still try for PAP again.
Mm-hmm.
I mean,
I'm
it's kind
thinking
of the
of
same.
talking to my MSL, but I gotta go find out who my MSL is because I know it was changed.
Mm,
I will say
What do
to
you
add
think?
to David's point, with your peer-to-peer, you can ask for it to be with a derm.
mhm.
Mm-hmm.
Has she done light therapy? At least in Montana, they have to fail light therapy for vitiligo treatment along with topicals. Has she done any of that?
Light therapy, no. Not the light therapy, but I put it as, natural light therapy because we're in Vegas. We have
Hey,
sunlight.
well, and that's what I've been doing as well. But the thing that I just did the other day on another medication
Hmm.
is that I put in like a cost benefit analysis of like, okay, instead of paying out on, sorry, I have a little one who wants to watch Old MacDonald all the time. Um, is that changing therapy? So if, for example, she was going on Dupixent and then Opzelura, they would be paying more on the insurance claim, like they would have to pay for two medications, and then the cost of light therapy, the cost of the appointments, the cost of the upkeep, make it make it look like the insurance is actually saving money by doing something they don't want to do.
Mm. Okay, that in mind this.
The other thing
Maybe
too,
that's something to consider.
to add to Anna's point with the phototherapy in Florida, I've argued the distance for the patient is too difficult to manage. You could argue that it would be disruptive of the school schedule, not to mention mom or dad has to miss time from
Disruptive.
work,
Okay.
and that it's impossible for the patient to meet the number of appointments required, and that they may have 6 months of clearance, 6 to 8 months of clearance, and it's, I think, maybe between 65 and 70% off the top of my head effective.
Mm-hmm.
But a caveat is it increases the risk of actinic damage. So you could argue that because you're in Las Vegas, that the patient already has sun exposure. If they have a family history of melanoma or non-melanoma skin cancer, I would argue that too.
Okay. Melanoma family history. Okay.
Or
You might.
non-melanoma.
The other thing I add is that even if um, they are able to do the natural sunlight, sometimes they still don't have adequate relief.
Mhm.
Right.
Good point.
Natural. So not adequate for me.
The other
Oh
piece
my gosh.
sorry to add more. Table 9 here.
No, this is awesome. You have no idea. This is the reason why that we do this because of these
Right.
hard cases. So it's not
Right.
just, making friends and stuff like that. This is
Right.
how we network. It's just making our work easy.
Right.
Especially I have a lot of information now. And I will definitely let the BCOD know that if this gets approved, I will have a party.
Yay.
Hey,
And
remember,
that's
it's
because
all
of
about
you
that
guys.
celebration.
That's because of you guys for helping.
Girl.
Also write
Oh,
down, Lou, that with Elidel with sun exposure, that it's contraindicated. So if they're using
yes.
pimecrolimus,
Contraindicated.
that's a
Yep.
good point.
Yes. Thank you. Yeah. Put that. Oh,
Look
I
at all
like
that.
that.
Look at all that fun stuff. Well, so Lou, you got a whole smothering
Yes, I do.
of information, which is fantastic. So I look forward to hearing how that goes. Sarah, before we jump into your case, I just want to make sure that everybody's aware that there's an upcoming webinar coming up. It is on Monday, November 17th at 7 o'clock. It's 7 to 8. It's with everybody knows her and loves her, Neo. She's going to be going over Tremfya with me, enhanced patient support. So I'm sure it'll be a bunch of fun. Never a dull moment with Neo. We love her.
Mm-hmm.
Absolutely.
And then there is another webinar as well. That'll be Next Level Skills, and that one is for Tuesday, December 9th. Again, same time, same place, same crowd, same fabulous people. And we'll just go over our next level skills, kind of like last time. So just wanted to make sure we touch on those 2 points because those are super important. And then we're going to be here at the end of the year. Can you believe it?
I know, right? It's approaching. It's around the corner.
It's
La 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 la
craziness.
la 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 la.
We wish you a Merry Christmas.
um,
Seriously.
right. So, all right. So we took care of housekeeping things, which is fantastic. Sarah, and obviously, I know 7 o'clock is kind of our cut point, but if anybody wants to stay on here and chat with us, listening to Sarah's is fantastic. Any insight is always helpful. So Sarah, tell us yours.
Sure. So mine came at, of course, as it usually happens at the end of the day. My physician assistant told me that she has a 12-year-old pediatric patient that has hyperhidrosis and she wants to start her on Botox treatment. And she's like, "Well, what do you think?" And I went, "Oh, crap." So I was thinking about it, and she goes, "Well," she's like, "I could write something in the note that says, with glycopyrrolate, the patient would be at risk of urinary retention, and that the patient is unable to use forgive me, I can never pronounce it, anticholinergics because it's off label." And so I shared with David, which he can share with the group, a list that I was able to get using my friend ChatGPT to write a letter of medical necessity, and I proofed it just to make sure that it's telling the truth. But it looked good, so I'm going to be submitting that to the plan tomorrow.
Okay. And of course, these last ones always have to come in at the end of the day.
Right at the end of clinic. It's like, well, if you can't get it, we'll have her do self-pay. I'm like, oh my God, that's a lot of money.
For Botox,
Yeah.
I
yeah.
So,
don't have that case yet. No.
so all of our Botox for hyperhidrosis is self-pay because we were having so many issues in general.
Mm.
But they can still submit to the Botox savings program. It just has to have the diagnosis of hyperhidrosis. The patient pays up front and then they can get reimbursed.
Okay.
But there is a device that somebody I was talking with at the conference was talking about. You can buy it on Amazon and use it at home. It might be worth looking to see if that would also be not an option to kind of also strengthen that. I can't think of the name. I just Googled machine for at-home hyperhidrosis.
Okay.
And then the machine probably have to use it every day, probably with dry sol as well. And so I would say add those in as well if you can.
Mm-hmm. Like that a lot. Yeah,
I know.
we're located in Southwest Florida, and one of the big things a provider mentioned with pediatrics is risk for dehydration, since smaller body mass, that would be important to note as well.
Hmm.
You might also put quality of life. I mean, if they're 12,
Right.
middle schoolers are mean.
Bullies.
Like bullies, time away from school or activities.
Right. Or social isolation.
Yeah. And, if they also um, can show why they don't want to use Qbrexza either,
Mm-hmm.
that might be worth putting in.
Yeah. No,
I feel like Qbrexza is even hard to get approved. There's little niches to get that approved, but
mm-hmm.
I know, like when I was more in clinic, yeah, Qbrexza was always really hard to get covered.
We
It's
just stopped
option.
doing Qbrexza altogether.
Wow.
Like,
You
we
have
just
another
don't
one
even.
too, right? Like the Sofdra or
Softra, yeah, that's another
oh,
one.
there's another one. I've never done any medical prior auth, so
Mm-hmm.
Oh, I
that's
That's
have.
really
it's
cool.
interesting.
So are you wanting the patient to, sorry, because we did do Botox through insurance for a while. Um, do you have access to like the billing portal for that patient?
As far as
Like
like
if
the
it's Blue
financial
Cross,
or through Availity?
sorry, like Availity, you can
Yeah,
submit it through
Availity I
there,
have. Yeah.
and it'll tell you like right away whether or not it's approved.
Okay, cool.
You have to use the J code that's associated with it, and then there's like a keynote denervation code as well
Mm-hmm.
for the medication.
Yeah, the
But
C
if that's the
code.
right unit, and that's how we got our Botox patients started, but
Mm-hmm.
then we just didn't get any reimbursement from it, so we stopped.
Oh, gotcha. We primarily, our patients are covered under the pharmacy benefit. I have a handful of patients that it's under the medical benefit, but we've had a lot of success in getting it covered under pharmacy.
The
Well, and
Botox?
I
Mm-hmm.
had
For
Oh,
hyperhidrosis.
I was able to get
okay.
it covered on the medical benefit, and Accredo can bill the medical benefit and then just ship it to the office.
Right. You just have to have their MPI listed as a service
Yeah,
provider. Mm-hmm.
yeah. And
You
if
guys,
you need help with the medical prior auth part, I can help you with that. I've done a bunch of those.
Gotcha. Those I'm pretty comfortable with. The nuance for me was the pediatric realm, but I appreciate the offer.
Oh, just title your whole PA request. Middle schoolers are mean. Please help me.
Exactly. Bullies suck.
kids are mean nowadays, aren't they?
Yes, they are. I can't even imagine being a kid these days. Like,
No,
Or,
no.
or watching people on TikTok, Instagram with their perfect skin.
right.
Well,
No.
it is crazy. I think somebody said it at the conference that look at all the people that work in dermatology. Our skin is like fantastic. I mean, I turned around and I looked at somebody. I'm like, I don't know what you're talking about. Like you're nuts. Um,
Say that the skin you can see looks great, but the rest is trash.
Exactly.
I wonder if you could add before I because I'm thinking about it for all of my patient, the DLQI, simple enough, but showing how much of an impact it has on her daily life
Yeah.
as a scoring tool that, I mean, mom could fill it out as to how much it's impacting her, dad, etc.
Yeah. No, I love that.
I love my scoring stuff because I make my providers go back and add it. Yes, sweetie.
We're there for a reason.
Yeah. And then you can also prove baseline and improvement if there is some.
Love that.
Nice.
Mhm. Now,
I'm
when's your
learning on that.
Sarah, when's your patient come back in? Or when's the tentative follow-up?
Don't know yet. I'm thinking hopefully a month. I haven't looked at her chart yet.
Okay.
My provider just walked by. I did what I call a drive-by and said, "Oh, by the way, I sent you a task." And I went,
Nice.
"Crap."
A hallway task.
Yeah, that's what I call a drive-by task. I'm like, "Oh, Lord. Okay."
That's awesome. I'm learning
Right
on
on
that one
top of that
too. That's
road.
cool.
Remember the movie Don't Tell Mom the Babysitter's DEAD? It was like, I'm right on top of that, Rose, when she's giving her all the work to do.
No, but that sounds like it.
I was gonna say, yeah, I mean, I haven't seen the movie either, but I mean, I'll go with it.
Yeah.
I would definitely go with it. So, well, does anybody have anything else? I mean, I think we're all stuck coming off our high off the conference, and that typically, we just keep going and going and going.
Right.
Mhm.
But
Adrenaline junkies.
right. Well, I mean, everybody's got, a lot of information. I want to say a little bit. Lou, you got
I got mine.
yep.
I got mine.
Sarah, hopefully you got some different things that you can,
Yeah.
utilize and twist for what you need for your patient, and your provider will be extremely happy with those outcomes.
Mm-hmm.
I just want to remind everybody about the webinars that are coming up,
Yes, thank
and
you.
thank everybody for coming in tonight. I know everybody has things going on, but taking a little bit of time out of their evenings. Naisha, we didn't hear a lot from you, but that's okay. You're here supporting us.
Thank you, Naisha. Thank you so much, Anna.
Yes.
Yes,
You're welcome.
Sarah,
No,
thank you so much.
Only one
don't
Welcome.
judge me. I'm driving, so I'm like I'm like listening and
We hear
no,
you,
hands.
sister.
Okay.
no judgment.
Today has been a rough day at work, so it's been a bad
Anna,
day.
if you have a good case, Anna, you if you don't mind, you can email the BCoD or David here
Mm-hmm. Yep.
for to share that hard cases because it sounded like you have that. And then for more, Sarah, like share it too because I know I do have more actually, but I gotta go gather all the informations and stuff.
Well,
never
And
Dorcas has my contact info. If you want to send me a note, we can chat offline.
Yes, I
Yeah,
will.
I can throw a thread together of emails for everybody if everybody wants, and then we can kind of pass the buck, see what
I'll put my cell phone number for Sarah.
Okay.
And Dave, I got a question real quick. I
Yeah.
thought next month I was doing the maximizers.
I believe you are. I think we just have to update it in the slide deck. I will double check with Kristen and I will get back to you. I promise.
Whatever. I can save it for next year.
No, I think some people want it before the end of the year, I think.
Okay. Well, just let me know.
Okay. All right.
I
Well,
could do chat, but
yeah.
David, yeah, you can text Sarah my number.
Okay. Yeah, I will share out the number. And anybody that has hard cases, any questions like that, we can get a whole thread going and whatnot and share tips and tricks outside of here. That's what we're all here for.
Yeah, thank you so much. Thank you so much. I'm definitely gonna apply that, and I will let you guys know what my outcome is.
Sounds great.
Perfect. Perfect.
Have a good night.
Good
Everybody have
night.
a
Thank you
wonderful
Bye,
evening.
guys.
everybody.
Good night.
Bye.